Cardiopulmonary resuscitation, or CPR, is a technique that combines chest compressions and rescue breaths to artificially maintain blood circulation when a person's heart stops beating. Inside a pharmaceutical facility, emergency readiness is critical because the working environment introduces specific risks. Personnel routinely handle volatile chemicals and solvents and operate heavy, active machinery. Exposure to these industrial hazards can trigger rapid medical crises. Severe stress or chemical exposure can cause cardiac arrest. Inhaled fumes can lead to respiratory failure, and equipment malfunctions can result in electrical shock. The goal of this training is to equip you, the on-site staff, with the precise steps needed to maintain a victim's blood circulation and oxygen supply in the crucial minutes before professional emergency medical services arrive. Because these specialized hazards exist throughout the lab and manufacturing floors, immediate intervention from a trained bystander serves as the absolute fail-safe to prevent a fatal outcome. Proper emergency response requires you to recognize the crisis, respond systematically, and apply physical care using CPR and an AED. Before you make any physical contact with a patient, secure the scene. If the victim has collapsed near a chemical spill or active transport route, carefully move them to a flat, firm surface away from hazards. Next, check for responsiveness. Tap the victim firmly on the collarbone and shout loudly to see if they react. If there is no response, activate your facility's emergency system immediately. Call the on-site emergency team or point directly to a specific bystander and instruct them to call for an ambulance. Verifying safety and securing help first ensures you do not become a second victim and guarantees professional backup is en route. With help on the way, assess the patient's airway. You need to open the breathing passage using the head tilt and chin lift maneuver. As this diagram demonstrates, an unconscious person's throat muscles relax, often causing the tongue to fall back and block the trachea. Tilting the head back and lifting the chin pulls that tissue forward, clearing the passage for air. With the airway open, take exactly 10 seconds to check for both breathing and a pulse. Place 2 fingers in the groove of the neck beside the trachea to feel for a pulse. At the same time, lower your ear near their mouth to listen for breath sounds, and watch their chest to see if it is rising and falling. If you confirm the absence of a pulse and normal breathing, you must immediately begin mechanical chest compressions. Look at panel 4 of this protocol chart. Place the heel of your dominant hand firmly in the center of the victim's chest. Clamp your second hand over the first, lock your elbows straight, and position your shoulders to drive downward. Compressions must be both deep and fast. Push down 5 to 6 centimeters, maintaining a strict rate of 100 to 120 compressions per minute. Between compressions, allow for full chest recoil. Pushing downward forcefully squeezes the heart, pumping blood to the brain. Releasing your hands lets the chest fully expand, creating a vacuum that pulls fresh blood back into the heart chambers. Panel 5 outlines the ratio for rescue breaths. After completing 30 continuous compressions, pause briefly to deliver exactly 2 rescue breaths into the patient's mouth. Repeat this cycle without stopping. If an automated external defibrillator arrives at the scene, turn it on immediately and follow the voice prompts. By executing these precise physical mechanics, you take over for the stopped heart. You artificially sustain oxygenated blood flow to the brain, directly preserving the victim's viability until medical professionals take over. This individual technique is a required component of facility-wide preparedness, heavily integrated into standard operating procedures. Emergency skills must be continually validated through documented mock drills, and your participation is recorded in good manufacturing practice safety logs. This local documentation aligns with global expectations. The World Health Organization establishes technical guidelines outlining the emergency readiness that facilities must maintain. Occupational health frameworks, including OSHA regulations and ISO 45001, mandate this strict level of medical readiness to ensure hazard mitigation. National laws also enforce these protocols. For example, the Indian Factories Act of 1948 explicitly requires formal first aid and emergency response training for industrial workforces. Individual emergency competency is a mandatory, audited pillar of global pharmaceutical compliance. Working in a high-risk pharmaceutical facility demands absolute readiness for sudden medical emergencies. Success relies on 3 distinct actions: rapidly identifying hazards, performing relentless chest compressions, and executing proper rescue breaths. Mastering these protocols allows the everyday workforce to step in and actively protect their colleagues when a crisis occurs. Widespread CPR empowerment directly saves lives and hardens a facility's GMP safety culture. To continue building your professional safety training and emergency preparedness education, subscribe to the channel.